to welcome along everyone to this Winter Incentive Scheme session. Before I sort of introduce everyone, I just want to go through a little bit of just one slide of why we're here. So the Winter Incentive Scheme was agreed as a condition of the sustainability payment received earlier this calendar year. £1 million of the 25-26 contractual framework quantum is allocated to Winter Incentive Scheme, and as part of the agreement, the Community Pharmacy Collaborative Leads have been asked to attend an engagement event, which is this event tonight, and this is intended to provide CPCLs with info relating to the scheme requirements, because CPCLs are going to be asked to cascade this information to local collaboratives and a bit of work with clusters, but you'll have a bit more information on that through the evening. So this is a joint session between ourselves, Welsh Government, and health boards. For Welsh Government, we have Natalie Proctor, head of the Pharmacy and Prescribing Branch, Emma Williams, Deputy Chief Pharmaceutical Officer, and David McRae, who's on secondment as a professional advisor to Welsh Government. And then delivering the health board session, we have Louise, who many of you will know, who's the head of community pharmacy at Cardiff and Vale, and there are a couple of other health board representatives here as well. And then we'll have a bit of an open discussion session. Very little from me tonight. I'll just be sort of facilitating. You'll all be glad to know. So I'm going to pass over to the Welsh Government team to deliver their session.
Lovely. Thanks, Aled, and thanks to everybody for taking time out this evening to join us. We're doing a bit of a tag team on this, so Dave is going to be sharing the slides for us, and then Dave, Nat, and I will be covering the presentation. We've also got on the call with us Gemma McClements, who's one of our senior policy officers at Welsh Government. So Gem is just observing tonight, just to kind of get a chance to meet you guys and just learn a little bit more about the collaboratives and clusters. Gem is quite new to pharmacy, so she's got a wealth of experience with dental contracts. Okay, Dave, you're right to share?
I've just had a eye share disaster. If you bear with me 1 minute, right. I'll have it up.
Cool. Okay, so we'll just we're going to do the first couple of slides without the slides, because I remember what they say. So just to kind of cover off what we're going to go through with you tonight. So there's kind of two parts to our session. So the first part is just us sharing some information about the Winter Incentive Scheme. I'm hoping that most of you will have had a chance to have read the communications that have come out over the last couple of weeks, but we thought it was worth going through it. After we've done that session, we'll pause just in case there's any questions or points of clarification that you guys need. And then we'll just move on to the second bit then, which is more about, I guess, how you guys as CPCLs can support with engagement in the scheme and some of the wider changes to the Common Ailment Service as well. Appreciate there's quite a lot of us on the call, so while the presentations are up, we're quite happy for cameras to be off. But when we move into the discussion sections, if you wouldn't mind putting your cameras on, because it's always nice to put faces to names, that would be fantastic. Moving on then, just in terms of, I guess, engagement and why we've put this evening together. I guess we're really conscious that you guys as CPCLs have been enrolled now for a number of years. And, you know, I guess what we know from the evaluation we did of the CPCL role, that particularly for community pharmacy is quite a well-established role now. You know, you guys are embedded in clusters. But through some of the, I guess, recommendations that came out from those reports, things very much around supporting you with your leadership roles, and I guess the bigger picture stuff would be you guys saw as being beneficial. So last year, I don't know, many of you had the opportunity to join the leadership training course that we put on, but certainly we put that on very much with a view again around supporting you guys in developing those leadership skills, giving you an opportunity to meet each other and meet some of the health board colleagues that also were involved in those training sessions. And the feedback from those sessions was really positive, and hopefully you guys saw the benefit of that training opportunity. Building on that, I guess what we would really like to establish, and we're going to try this tonight and really happy to take your feedback on it. We think that there's real value in you guys having a chance to meet with health board leads and us as Welsh Government, twice a year, just to kind of talk about the national priorities around community pharmacy and how you as CPCLs can support that kind of engagement of the community pharmacy network, but more importantly, probably the wider primary care network in terms of the services and the things that community pharmacy offer in that wider primary care picture. So tonight really is about, like Aled said, giving you a chance to learn a bit more about that winter incentive scheme. Want to try and understand your needs in terms of what you need from us and from health boards to be able to cascade that information and share it within the wider networks, and to give you a chance just to ask us some general questions as well if you've got any that you would like to. So like I said, what we'd really like to get to a point with is that twice a year we meet with you guys. We'll have things we want to talk about. We're also quite happy for you guys to suggest agenda items as well, and we can make this a kind of regular thing. We don't particularly want it to be formal kind of a way tonight. We probably are a little bit presentation heavy because it's the first one that we've done, but certainly want this to be interactive and to give you guys a chance to talk as well. So we shall move swiftly through it. Can you move me on, Dave, please? Just, I guess, to start us off, as you know, part of the winter incentive scheme, all of you will have had the A1 posters that have come out to you all, and we've asked you to put them up in the window. And I guess the call to action for patients is ask us about the Common Ailment Service. And just in response to that, what we'd be really interested in is if somebody came into your pharmacy and said, tell me about the Common Ailment Service, in a really short, 30 seconds, what are the types of things that you would say to patients when they asked you about it? If you can put your thoughts in the chat for me, that would be really helpful, and we will come back to it in about half an hour later on in the presentation. So you don't need to do it straight away. Have a couple of minutes to think, and then if you could start popping that in the chat, that would be amazing. Okay, so moving us on to the more meaty part of the agenda. So we're going to cover off in this session the CPCF Winter Incentive Scheme. So I'm going to hand over to Dave and Nat to take us through this section.
Lovely, thanks, Em. I suppose just to kick off and say then, so the first part of this Welsh Government session, we're going to walk through the 2025 Winter Incentive Scheme. So we're aware that there is lots of information already been disseminated on this, so I guess this will be more of a consolidation piece, but we have scheduled a Q&A at the end of this sort of first part, so if people can just hold any questions up until then, and then we'll have a discussion. Like Em's already said, there have been some winter incentive comms assets or posters that have been disseminated out to pharmacies already, and we are aware that there have been a number of questions arising around posters and delivery and things like that. So I suppose just to acknowledge at this point, we are aware that there are questions arising. We worked with an external printing and courier service, so we have been able to get a full list of those sites that were delivered to, the date, the time, and who received those. So we are working through any questions that are coming through. Okay, so as I said, in the first part, then we're just going to walk through the winter incentive scheme, so of which there are 3 parts. So element 1 is participation in a CAS patient-reported experience measures feasibility study. So I'll be handing over to Dave shortly, and he's going to walk us through some slides on element 1. Element 2 of the winter incentive scheme then is participation in the Help Us Help You winter campaign, where Common Ailment Scheme features heavily there. And element 3 is around the inclusion of the management of sore throat and urinary tract infection as part of the standard CAS offer. So I'll hand over to Dave then, and he'll share some detail on the PREMS on element 1.
Thanks, Nat. So I'm going to pick up, as Nat said, on the PREM study. I'll just get back to the right slide. Okay, so the background to the PREM study, and many of you will have received information about the study already in the cover letter, is the global move towards direct patient-reported experience of healthcare services. For those of you who've had hospital appointments, for instance, it's very difficult to get out of a hospital appointment now without receiving a text asking you how did the appointment go for you, and then in terms of the local drivers. the NHS has long recognised patient experience as a quality measure and also a safety measure, and that was part of the Welsh Health Circular from 2024. And there has also been feedback from both Community Pharmacy Wales and community pharmacy contractors questioning the necessity and the value of the requirement for pharmacists to record the experience outcome measures that are already in the Choose platform. And this was also supplemented by the feedback that was captured by the Choose Pharmacy redesign work, where there was a request made for the PREMS questions to be removed from the Choose Pharmacy platform. So the feasibility study lead is Professor Effie Mansourani. As many of you may have come across Effie in the work that she did initially around the sore throat test and treat evaluation, published here in BMJ Open, and also the ongoing evaluation of the UTI service. So the online survey, which we were asking contractors to share with people who have undertaken a common ailment scheme consultation, is available both in English and in Welsh, and it has been available since the 1st of October, but obviously we'll be capturing it from when the materials have arrived, so that's from October the 25th to the 31st of March. The survey was developed by the study team, and it's been developed extensively with members of the public in terms of for clarity, and we've received an awful lot of feedback about making it clearer and more relevant, and it has, for your assurance, ethical approval that was granted by the Welsh School of Pharmacy in September. As it says at the top, all of the patient-facing materials, so the A5 posters and the credit card side QR leaflets are all available in Welsh. In terms of what information is available to be shared, so when participants complete the questionnaire, no identifiable information will be passed through from Cardiff University to Welsh Government, and that was a part of the ethical approval for the study. So, as part of the Winter Incentive Scheme requirements, the ask is that the A5 poster will be displayed in the consultation room, with additional posters in other areas of the pharmacy, so the 3 in total, so perhaps one on the counter and one in the window. And then between the 1st of October and the 31st of March, that following a common ailment scheme consultation, that the person conducting the consultation provides the patient with brief information about the study, encourages them to provide feedback, and that they document in the additional information section of the CAS consultation record within Choose the word PREMS or the code PREMS. Should the patient wish to complete the survey elsewhere, you can provide them with the QR code, which is on the credit card leaflets which have been provided, allowing them to take away and scan the QR code at another time. The important point to make here is that whilst the survey is ongoing, because what we're doing with the survey is looking at the feasibility of this data collection, it's important that the existent patient experience measures, which are integrated into the Choose Pharmacy, continue to be completed. So the evaluation report, which will be written by Cardiff University, will be available in May 2025. And if, because this is a feasibility study looking at how effective it is to collect this information via, electronically via the QR code and the link to the electronic survey. It is our commitment to review the need for the PREMS questions within the Choose Pharmacy module, to look at a digital solution with one possible outcome, maybe being that push notifications are sent via the NHS Wales app following as notifications are automatically prompting patients to do it. But what we are acutely aware of is that there's further work needed to consider the accessibility of the survey, particularly for those people who are either uncomfortable or unable to access the survey online. So I'll hand back to you, Nat.
Lovely, thanks, Dave. So that covers off element 1 of the Winter Incentive Scheme, which was the PREMS research project as outlined. So element 2 is participation in the Welsh Government Help Us Help You Winter campaign. So just moving on to the next slide. So as part of the winter 25-26, we've been working with the Welsh Government comms team, who've developed a series of assets which are going to be used across social media, TV and radio. And as I said, a really heavy focus on the Common Ailment Scheme. We're really lucky that I think the Welsh Government comms team are such huge champions for the community pharmacy network, and they're always coming to us and asking what they can do to help us to promote the services. So thanks to the Welsh Gov comms team, but also you'll notice the pharmacist that's used in the campaign this year is one of our own pharmacists, Hayley, who's from Kincoid Pharmacy. So really grateful to Hayley for all of her help with this. We'll share these slides with you so you'll be able to click on these links. If we can, we'll show you the first link. So this is the winter advert, which is going to be published and live shortly. So this is a sort of sneak preview of what's going to be coming out on the TV. We do have it available in English and Welsh. If we can, we'll just play it in English tonight. But I said we'll share all the links so you can see it in full after.
Uh-oh, looks like it's one of those days where life's little inconveniences don't feel so little. When a minor illness throws you off track, the first place you should go is your local pharmacy. They offer free, confidential advice and treatment for many common conditions. Ask about the Common Ailment Service or search Help Us Help You Wales to learn more. NHS Wales, it's all part of the service.
Brilliant. Thank you, Dave. So as I said, there's sort of a whole range of winter assets this season that's going to be starring Hayley. So they've used various still images as well from that recording. And we've been this afternoon approving even more that are due to come out. So said there'll be you'll be able to access some of these links. The other links there take you to the Welsh Government Asset Bank. So all of our digital assets are available for you to use either across your own social media sites, or if you wanted to print anything yourself, they can all be printable. And again, they'll all be bilingual or in English or Welsh. Fabulous. I think that takes us on to the next slide then, Dave. So in addition then, comms colleagues have helped us to design and print this winter poster, which we've already mentioned has been posted out to community pharmacies already. An requirement of the winter incentive scheme is that the poster needs to be displayed in community pharmacy windows from the 6th of October until the 31st of March. I mentioned at the start, we are aware that there are some queries around delivery, so best thing to do would be to get in contact either with your health board lead or with Community Pharmacy Wales to raise any of those concerns. As I said, we've got a full list of all the dates and times that those posters have been delivered, so we're able to see whether they genuinely haven't been delivered. There's a very small number where premises have ceased trading. We know they haven't been delivered, and some deliveries were attempted a second time around, either Monday or Tuesday this week. So, on the whole, we know that the majority of those have all been received. Obviously aware also that some contractors have corporate branding guidelines for windows displays. So if that applies to contractors, we're happy for them to print an alternative poster based on their own sort of digital branding guidelines, and they can display that instead of the A1 poster, but it must sort of capture some of the same messages, and it needs to be equivalent to the A1 area that is presented within the Welsh Government poster. Okay, Dave, I think that will take us on then to element 3 of the winter incentive scheme. Thank you. So this is just the inclusion of the UTI and sore throat as part of the standard CAS offer. So following changes to the Common Ailment Service this year, all pharmacies are now required to offer the management of sore throat and urinary tract infection as part of the standard CAS offer. So on to the next slide then, the specific requirement of this winter incentive scheme is just to ensure that all contractors are making sure that this revised pathway for the management of sore throat and UTI is fully implemented so that all patients are able to consistently access CAS for the management of these conditions. Just the next few slides then, we've got a couple of bits on the resources that are available to support the winter incentive scheme, and just a very small part on record keeping. So as already mentioned, number of resources that have been designed, printed and already distributed. So that's the large A1 poster for Windows, Dave covered off the A5 CAS Prems posters, so 3 of those should be arriving, and then the smaller QR credit code leaflets as well. So in addition to those that have been posted, we're working on getting all of those available electronically. As many of those that are available already will be on the Asset Bank, which is one of the links that we've included on one of the previous slides. There's also been an electronic letter that's gone out to all pharmacies, so that details the requirements of the winter incentive scheme. I believe that's also available via the CPW website, Alid. I'm sure I've seen a section there on the website, as are some other documents as well relating to the scheme. And then finally, just a slide on record keeping. So element 1, then that's the PREM study. So no additional record keeping required here. Welsh Government are going to receive reports via DHCW. With regards to element 2, the winter poster, again, no additional record keeping. We're expecting those posters to be displayed in windows. We'd consider it reasonable that, their presence is noted via one of the routine health board contract monitoring visits. So nothing in addition for you to sort of submit with regards to the NECAP declarations or anything like that. And then element 3, again, no additional record keeping. We'll be seeing changes in service activity, which will be monitored via CAS stats. I suppose to specifically note, there's no necessary targets, but, these are just examples of how you can demonstrate that CAS is being routinely available via the pharmacy. So again, we'll share the detail, which you'll be able to look at in your own time via these slides. So that was kind of a rush through the winter incentive scheme, but aware that I had seen some questions regarding posters in the chat. So hopefully we've covered that off. If you are having issues, to contact either CPW or your health board lead. But happy to pause there and take questions from anybody that'd like to either raise hands or put them in the chat. If there are any questions. Should we take
Got one from Sarah in the chat. To clarify, am I right in thinking PREMS needs to be recorded on sore throat and UTI as well as they are CAS? So yeah, it's don't mind me taking this. On any CAS consultations, and on the CPW website, which I put the link to the winter incentive scheme page in the chat. We mocked up a document showing you where on each page you should record it.
There was another question, I think, in the chat from Gavin. So Gavin, I assume that's if you're IP and you are covering UTI within your scope as an IP, you're suggesting there that the default would be that you would offer that service via IP rather than CAS.
Yeah, that's right. There was just a query that had come up that with UTI being done under IP as opposed to obviously under the common ailment scheme, it's not going to be recorded in the same way. And if they're looking at the percentage increase of pharmacies offering it, if you've got an IP in store, it may not necessarily show that increase. So I just need to make sure that pharmacies won't be adversely looked at if they weren't putting that through.
Over to you.
Yeah, do you want me to pick that one up? So yeah, Gavin, and in the comments that we've put out to health boards and to contractors, and hopefully again you'll have seen that letter, and if you haven't, it's available on the CPW website, and I'm sure the guys will put the link in the chat. We've put a section in there specifically on this this issue. So we are aware that there are probably a number of IPs at the moment who've got a limited scope of practice, so that they are majority of the conditions that they treat will be UTI and potentially sore throat. So what we've said in the short term is absolutely that there will be no disadvantage to those pharmacists who've got that narrow scope of practice in terms of this winter incentive scheme. So in terms of the service being available, what we mean by that is that there's a CAS accredited pharmacist on the premise, and by definition now, if you're CAS accredited, you are also able to provide sore throat and UTI. So what we would be looking for in terms of engagement with it is from the CAS data, not necessarily seeing increases, because we're very mindful that we don't want to put targets on this. So, you know, if your CAS data shows that the CAS service is available, you know, every day you're up and you've seen somebody, then that is sufficient evidence. So this isn't about being punitive. It's just about making sure that that service is routinely available. In that information as well, you know, we've said that for those pharmacists that have got a limited scope of practice, for the pharmacist independent prescribing service, the longer term ambition for that service is that the full range of PIPS conditions are able to be offered by community pharmacies. So we start building that consistency of offer in the same way we built the consistency of offer in the clinical pharmacy service. We know that takes time, but it's very much about engaging with health board colleagues who are, or a lot of them are on the call tonight, around how they can support you with extending that scope of practice. But certainly for this scheme, there's not intended to be a detrimental effect for those people. And thanks for putting that in the chat, Aled. That was super speedy.
Dream team, thank you. So just to pick up another question in the chat, so will the PREMS feedback be available at pharmacy level, i.e. will the pharmacy be identified in the data? And Dave, please correct me if I'm wrong, but you know, as per the it's quite strict detail that we had to put in for the ethics approval, so absolutely no, any sort of feedback or response that comes in via that survey, you won't be able to identify which pharmacy that was linked to. Dave, if that's wrong, please say.
No, that's absolutely correct.
Perfect, thank you. I can't see any other questions in the chat, but if I missed any of them, please flag, or happy to take any other hands if there were any more questions. So is there a way to amend if you've asked but forgotten to annotate, or can we put on the patient's PMR? So somebody yesterday forgot on 2 consultations but remembered before the medication was given, so they've been invited but it hasn't been recorded. And we did have a discussion on this point, didn't we? I can't remember what we'd said. I'm pretty sure you can't go back and amend the record once it's been submitted.
Yeah, I guess what we've said is, again, you know, we accept that there are occasions when you might forget, and that's okay. So we're not looking for 100% year, but we expect that PREMS code to be on the majority of consultations that we see over the next 6 months. So it's okay to forget every now and again, but it's just that thing, and we accept at the moment that it's new, so it's getting into the routine of doing it. So yeah, you don't need to worry about going back if you forget one. It's just that thing about, I guess, not forgetting going forward, if that makes sense.
Yeah, and I guess as hopefully this becomes a bit more you know, ingrained in that this is part of the winter incentive scheme for this year, there would be the expectation that, like Em said, the majority of consultations then does have PREMS recorded, and if the number of CAS consultations coming through doesn't necessarily correlate with the number of PREMS codes that we're seeing, then that might sort of trigger a bit of a discussion with you know, community pharmacy health board leads as you know, just overseeing the elements of the contract, I guess. So there was another question there from Gareth. When will the PREMS being documented in additional information text box be checked? Is it from the 6th of October? Yeah, so I suppose in terms of implementation dates or start dates of the winter incentive scheme, we did have to push it back to the 6th of October just in terms of getting everything lined up ready. So as far as I'm aware, again, correct me if I'm wrong, but it will be from the 6th of October.
Do you want to take that?
I was just going to say that because the A1 poster will be from the 6th of October. The PREM stuff, because we had to delay that until Monday the 20th, which I think is this week. I've lost track of dates. Because that was delayed because of the resources coming out. We won't be looking at that before the 20th of October.
Sure. So a bit of extra time on that one then, Gareth, for the PREMS. So as of this week, start recording. I think that was all the questions in the chat. So if everyone's happy, we'll move on to the second part of the Welsh Government session. I'll hand over to
Lovely, thanks, Nat. And for this bit, I guess we've got some slides, but I quite like to keep the talking short on this section, and then maybe give us a bit of time just to have a conversation around what this could look like in terms of the role of CPCLs. So, Dave, can you move me swiftly on? Fab. So this is a bit of a busy slide, I'm afraid, but where we started with this this idea for this evening event was like I said earlier, very much focused on when you guys came into role as CPCLs, you had quite a nice, I guess, job description or role description, for want of a better word, which kind of set out the expectation of you guys in terms of delivering on the CPCL role, and the things that kind of stood out to us particularly were, you know, you've got a real role in terms of leadership and coordination. You very much represent your colleagues within the cluster, and you also support that collaboration between community pharmacies and other cluster partners. So that's your GPs, your dental and your optometry colleagues, and then the wider health and social care colleagues that sit on that cluster. And you very much support that development and hopefully the delivery of the cluster plan. So you've got a real opportunity, I guess, to kind of building community pharmacy delivery services into that agenda. You've also got a real role in terms of comms and engagement, and again, being that link between pharmacies and the wider teams, and having the opportunity to speak to colleagues who are maybe not part of the normal, I guess, healthcare professionals or the people that you talk to day to day. And there's also a section in there around data and quality improvement. So about making sure that the services that we deliver, we're always looking to improve on them. We're always looking to make sure that we've got the right data to support the delivery of those services. And very much as you guys, I guess, being that link between your colleagues, the health board, and hopefully us, we see a real role for you in kind of getting some of that quality improvement work onto the agenda as well. Dave, if you can shift me on again, that would be great. So I guess we kind of sat down and thought, right, what is it that we're asking you to do specifically around this winter incentive scheme? And we came up with a couple of ideas, but we'd be really keen to kind of, like I said, discuss with you on other things you think you can do. So most of you will be aware that because of the changes to the Common Ailment Service this year, we've made 2 changes to that service specification. One was made to support the sore throat, and we've just put in another change to support the changes to the UTI service. And in bringing UTI into the Common Ailment Service, we've also looked at that service specification and I guess gone back through it, and in doing so we noticed that there were things that were historically in that Common Ailment Service specification that have just been kind of lost over time. So we've put in a couple of additional I guess clauses or requirements into that specification, and I guess, you know, in your collaboratives, it would be really helpful if you could just double check with your colleagues that everybody's seen that new specification and understands what those changes are in terms of delivery of the Common Ailment Service. None of them are particularly rocket sciencey, and they shouldn't be things that you guys are not already doing. But again, it's just that kind of clarity. So Dave, if you can shift me on when. So just in terms of aims and objectives, this clause was, I guess, historically in the Common Ailment Service, and we've just kind of put it back in just to kind of re-establish the purpose of the Common Ailment Service, both within the CCPS and also in terms of the, I guess, the wider provision of healthcare. So very much focusing on that community first pharmacy model. So we're looking, you know, increasing access to appropriate care from appropriate healthcare professionals, reducing pressure in some of the other areas of the service, and very much focusing on supporting the self-care agenda and appropriate use of NHS resources. And around self-care, we did a lot of work when we brought CAS out in 2013, and there was a lot of evidence at the time to say that patients who routinely go to their GP for a common ailment are unlikely to change their behaviour until they've been told to do something 5 times. That's the average time it takes for somebody to take on board that behaviour change piece. And I think now we are, 12 years down the line in terms of common ailments. I guess what we think is possibly there now is that we've moved people from GP to pharmacy, but those people are not able yet to self-care, so they're not confident to self-care. So that piece, and the opportunity you guys have got in those really important consultations, in that consultation room where you've got one-on-one time to talk to patients about how they can self-care and increase their confidence to self-care in the future is really important, and I'm sure is something that is already something that you guys are doing routinely. Moving on, Dave, we've also kind of put in a clause around incentives. This again was previously in the specification, but came out, and it's just again, I just to kind of just set out that pharmacy professionals shouldn't be offering incentives or inducements to patients to encourage them to access the service. We get asked sometimes about what about incentives for the staff. That isn't something that is a contractual issue, but if we're asked for a line, then our view would be that anything that is an incentive scheme just needs to comply with general pharmaceutical service GPHC service standards. I can't speak this evening. Next one, Dave. And the last one is something which is new to pharmacy, but it's routinely in all of the kind of service documentation and regulations for dental, optometry and GP colleagues. And this is just around, again, responsible medicines use. Pharmacists spend all of their life talking about responsible medicines use. So again, this should be something which you guys are, already on board with, making sure that where we're supplying meds, that they're clinically appropriate, in line with formulary guidance, and very much supporting the antimicrobial stewardship message. And because you guys have all done the UTI and the sore throat, you've already done that really important AMR piece as part of that accreditation. So, we see you as being in a really great place to support that AMR messaging. Dave, if you can shift me on. We asked you earlier on if somebody came into the pharmacy and asked you about the common ailment service, what would you say? Thanks to those of you who popped something in the chat. I've just popped back into the chat. We've just done a bit of a word cloud of what came out of what you guys said, and very much it focuses on, its treatment for, we're going to catch you out, some of you have said 26 conditions. I think we're up to 28 now, although we do have to keep going back and counting on our fingers and our toes and then borrowing somebody else's because we've run out. But it's 28 common conditions. Really great to see you guys saying, it's about, you don't need to see a GP, and that the service helps kind of ensure that people with more complex needs can see the GP. Really good that you're giving messaging around, we can usually see you in the same day, but you may need to wait, so give us a ring before you come in. So very much focused on that messaging about this treatment for common ailments without a GP appointment in a consultation room. Just so, Dave, you can move us on. We did the same in the office, what we would say about the common ailment service. And I guess we came up with similar sorts of things. So we kind of came up with, when you have symptoms, it could be a minor illness, but you're not sure how to treat it, or you've had it before and your symptoms are different. Come in and see me first. Private consultation, give you advice and treatment if you need it. And I'll let your doctor know that you've been to see me, and you'll know that the advice and treatment that I've given you. And I guess the other thing that came up was, the messaging to patients about don't let cost be a barrier to asking for help. Definitely 28. We have to go back and check now. The complication is ringworm and intertrigo sometimes get called 1 and sometimes they get called 2. So they move from being 1 condition to 2. So if you call them 2, it's 28, she says, because that's the one that always catches me out. Dave, if you can pop us on again, that would be great. So I guess as well as kind of talking through those changes to the common ailment scheme and maybe having that conversation with your colleagues about what they would say if a patient asked about the common ailment service, it would be really great if you guys could use the opportunities you have within the cluster to talk about the fact that sore throat test and treat is now part of CAS and that the UTI service is now part of the standard CAS offer as well. I guess this is going to vary across Wales. So if you've got local referral pathways that you've agreed as a collaborative or as a cluster, making sure that they are reflective of those changes. And if you don't have those referral pathways, is that there's something that they would be valuing in trying to look at that as a cluster at a level. And And then, like I said, that thing about how can we support patients to access the right service at the right time. So, very much the strapline of the incentive scheme is help us help you. So in the same way that when a patient goes to a GP and the GP doesn't need to see them, that the pharmacy can see them, the GP has that conversation. It's the same thing with the pharmacy. So how can the pharmacy have the conversation with the patient about that self-care agenda? And we know that we've probably not done enough on that in the past, but it's something that we're really interested in going forward. Thanks, Dave. You're doing a sterling job on the slides, by the way. And then the kind of last thing I thought is about engaging the collaborative. So like we said, are they aware of the changes? Do they understand the winter incentive scheme and how to engage in it and what they need to do? Are collaborative colleagues confident in having those conversations with local practices regarding the changes? And are they confident in having conversations with patients about that PREM study?